So now that the health care bill is headed to the president's desk, what is coming next? Scoreboard staying ahead of the curve, looking at the many implications of the House vote with our panel of experts. We have Democratic strategist Doug Schoen, who is author of The Political Fix, Dr. Gary Gonsalves, and Elizabeth Wydra, Chief Counsel at the Constitutional Accountability Center. Good to see you all. Doug, I want to start with you.
Sure.
The political side of all
Sure.
this. McCain and Gingrich say that this will not stand. Are they right?
Well, time will tell. Here's the politics of it, David. The Republican right, the independents on the right are going to fight like the Dickens to stop this, repeal this, roll it back any way they can, the courts, whatever. And it's going to be a mobilizing vehicle for the fall elections. The real question, and it's the unanswered question out of last night, is will the Democrats be able to rally their troops, who heretofore have not been mobilized and not been strongly supportive, in support of the obviously popular parts of the measure that so far have not won much support
like
or got
what,
much,
for example?
Like the pre-existing conditions, the stay on your parents' health care until 26, the no lifetime caps, things that are positive. Now, that may well be a bad bill, and David, I've argued that long-term it's unsustainable and bad politics, but the political question, the analysis, is will the Democrats be able to use this success to mobilize their constituency on this and other issues?
All right. Well, Elizabeth, let's talk about perhaps the most unpopular thing among both Republicans and Democrats, those with libertarian bents, that is the government forcing people to buy insurance. A lot of people, it just gets under the skin of what Americans are about, being forced to do something like that. You heard the challenge from Utah. There are about 12 states that are going to challenge this thing. Do you think they stand any chance at all? They even admit it's an uphill battle, but do they stand a chance?
Well, I think that, the lawsuits that the state attorneys general have been talking about in the last few days were certainly to be expected. I don't think anyone is surprised by it, but I think that they are unlikely to be successful. And that's because the Constitution gives Congress several well-established grounds for regulating health care. So first would be the power that the Constitution gives Congress to tax and spend to promote the general welfare. Right. And certainly one would think that ensuring that millions of Americans have access to affordable health care counts as promoting the general welfare of Americans.
Well,
now,
that's kind of a stretch. That's kind of a stretch, Elizabeth. And Dr. Gonsalves, I mean, that's the point, is that when people read things into the Constitution, they get carried away. And some people said that
that's what Roe v. But those are the exact words of the Constitution.
Elizabeth. Doctor, they said that's part of what Roe v. Wade was about, and now they're doing it with health care. Is there going to be a popular revolt, and you are in touch with the Tea Partiers, about this, about the Congress and the presidency going way beyond what the Constitution allows?
David, absolutely. We're going to see a huge revolt coming out of the Tea Partiers, and we're seeing it happening today and last night, just in terms of the hits that we're getting at the StopTaxingUs.com webpage, and people that are really getting motivated to help promote things like our April 15th Tax Day Tea Party in Oceanside, California. I mean, last year we had 5,000 people. I won't be surprised if we double that this year. I mean, people have gone from concerned, and now they're motivated. I mean, they just really want to get out there and enlighten people about what this bill is all about. And to find the lies in this bill, you don't have to search very far. I mean, they say that this bill will save $120 billion over 10 years, but they leave out the doctor fix. Okay, and I'm a doctor. I benefit from the doctor fix, and I'm against what this is. And the doctor fix is simple. Doctors are resigning from Medicare, and if they cut Medicare by an additional 22% this year, even Medicare says another 20% of physicians will resign.
Does the anger of the people subside a little bit now, since the Democrats obviously won the vote last night, or does it build as a result of Democrats going beyond what the public wants them to do?
I think it's going to be both. I think in the short term it will subside, but in the longer term, events have impact, and they are discrete in their impact. The long-term anger that Dr. Gonsalves was speaking of is real and palpable, and from the research I've done, is not going away anytime soon.
So, Elizabeth, does this count for anything with the legal challenges?
Well, you know, I think that people are certainly free to voice their disagreements, but when you're getting to a genuine legal disagreement in the courts, then you need to make a constitutional argument. And simply saying that it's bad policy isn't enough. And I think that, you know, there's also the Commerce Clause power that Congress has under the Constitution, which your guest talked about earlier, which I think supports the health care plan, as well as Congress's broad authority under the Constitution to pass necessary and proper legislation to promote the general welfare and regulate interstate commerce, the powers that the Constitution gives to Congress.
We have to leave it at that, but I got to ask you all, but every time I have all of you folks on, I want to go for another 5 minutes or so, but I'm afraid we run out of time for this one. Thank you very much. Good to see you all. Coming up on deck.